Hi everybody. Thank you very much for listening to our presentation in advance. Attention deficit disorder, hyperactivity, what should be taken into account in the therapy? I'm going to be mentioning about that. These are the this is the outline of my presentation, but the main purpose of this presentation actually is to contribute to the clinical practice of the university students a bit. I'm sure that there are people here who evaluate university students or else who work in medical social centers. This is the health center of Koç University. We work as a team and we provide psychological treatment given by 4 clinicians, and we've got 3 psychiatry specialists. We psychiatry specialists go on particular days of the week, and we evaluate the students on a psychiatric level. Attention deficit disorder, hyperactivity, why is it a problem? And why do we concentrate on university period? Of course, university is really important from people to turn into adolescence, from adolescency to adulthood, and also even though people who do not have ADHD, they for the first time leave their homes and go to another city, most probably. So it's a period where they have conflicts or some uncertainties, and they're afraid from away from their families. They don't have many friends. So for that reason, this is a challenging period both for ADHD and non-ADHD people. What problems do we encounter in the university period? Of course, academic performance, and also relationship problems, romantic and friendship problems, and family problems, and also self-esteem. Especially when ADHD is not treated, low self-esteem really actually more exasperates ADHD. Do you know Adam Levin? Have you heard of him? Maroon 5, he is the lead solist of Maroon 5 because he participates in many campaigns, especially in order to draw the attention to ADHD in relationships. He actually and in the youth period, because I remember myself as an ADHD child, he says, and actually this is reflected as a positive thing, you know, and young people know him, like him. So these popular people, they also help a lot in increasing the awareness of ADHD. So, I mean, university students are aware of the ADHD, and they wondered whether they have ADHD. They ask us, they also go to other places to receive consultation, and the awareness is also increasing. So what do we know? What do we know about ADHD in the university period? According to United States studies, the rate is forecasted between 2 to 8%. It is forecasted, as I said, because it is based on self-rating, and from one university actually a sample has been taken, so there isn't a large-scale study which actually represents the whole nation, but we see that the prevalence is between 2 to 8%, and actually health workers, they do not feel themselves comfortable, the healthcare providers, in diagnosing and treating ADHD. And on the other hand, the most common presenting problems are depression, anxiety, and ADHD. And we said that awareness increasing is important, and now students come and ask us whether they have ADHD because they read many things and they know the symptoms actually, and they even know the criteria and come up to us. So in some cases actually this is also a bit challenging. However, well, most probably the patients that we will see will have this profile. I mean, they will be aware of the symptoms of ADHD. So diagnosis of ADHD has been described in this Congress by many experts. So for that reason I'm going to keep it short. But in the university period, the diagnosis and evaluation of ADHD is no different from lifelong ADHD. And it is based on an extensive clinical evaluation. We don't have any biomarker, unfortunately. We don't have a single method of test that enables us to have an accurate ADHD diagnosis. Dr. Woodmet Arkso, I would like to make a recitation. He says that this ADHD diagnosis is like tailor making. So it's like a tailor's work, so you have to know the measurements. And I really like his quote. Well, there are many scales, clinical interviews in order to come to a diagnosis. Even though it is not regarded as a golden standard, the most reliable is the structured clinical interviews. There are many structured clinical interviews. The most important aspect is that not only the consultee, but we should also have a person who knows the family of that consultee, and him or as her. And for stimulant usage, actually university students do pretend actually just to use the stimulants. So for that reason, also interviewing another person that knows that person or as the family is also very important. A person or else a person from the family. And symptom rating and screening scales can be used also for the assessment of ADHD. Functional impairment and quality of life scales. These are things that we can also use. I'm not going to be talking about that because Dr. Wahdet is going to be mentioning more. Morbid conditions such as substance usage, anxiety, they are comorbid conditions. So this should be a part of diagnosis and evaluation. And here, adult ADHD symptom rating and screening scales can be found. And ADHD rating scale depends on DSM-5. And there is also adult ADHD self-report scale symptom checklist, Berkeley adult ADHD rating scale, and some 4 criteria are screened in the scale, and it is a valuable tool for screening. These are structured diagnostic interviews. Maybe in previous years, if you've come to this conference, you know DIVA, for instance. It has been translated into Turkish and a course was given about it. And in the next session in this Congress, ACE and ACE Plus courses will be delivered. I highly recommend you to attend those courses. DIVA, I frequently use it in my daily practice. All cases actually that requires a diagnosis. It has got many details, of course, these scales, and actually it gives a full picture of the case, these scales, and structured interviews. DSM-5 also has another interview, structured interview. With DIVA and ACE, you don't have to purchase them. You can just download it from their website. But DSM-5 clinical interview, you have to purchase it. So what is taken into account? DSM-4 and 5 criteria are taken into account. And all of these structured interviews do actually screen the childhood and adolescent ADHD details, criteria, especially the functional deterioration, and how much it impacts one's life. It also evaluates, these scales also evaluate that factors. I'm going to be talking about a study now, and I would like to highlight this. In order to be diagnosed as ADHD, both in terms of hyperactivity impulse and attention deficit disorders, 5 out of 9 criteria should be met. However, there are some authors, and this is a study which has been published in American Journal of Psychiatry and Attention Disorders. 4 criteria, well, rather than 5, 4 criteria can also be sufficient in order to evaluate the attention deficit disorder amongst university students, but this is not, of course, a overall respected practice. Another study which concentrates on adult ADHD and makes a recommendation. There are again 4 criteria here that is associated with attention deficit and hyperactivity, and those 4 criteria, if they exist during childhood and adolescency, then a diagnosis can be made. So the study recommends. ADHD. Its mechanism is cognitive, and its root is biological. However, as an appearance, it is behavioral. So we have to evaluate all of these aspects. And in the treatment, the most dominant symptoms should be taken into account when treating it. Well, I'm going to be talking about them briefly. What topics are more important at university in terms of our medication treatment? Psychostimulants, amphetamine-based and methylphenidate-based. Mostly methylphenidate-based we use, because since the 1970s we don't have any amphetamine-based psychostimulants. And there are non-stimulant medications as well. In the Congress, Dr. Umut Mert mentioned about it in detail. In the first place, there is atomoxetine and noradrenaline or dopamine enhancer antidepressants, clodine and guanfacine are recommended as a second resort. Amphetamine is not available in Turkey, so that's why it is not a medication that is in our clinical practice. So when evaluating these students, what kind of problems do we encounter? Well, mostly they miss interview hours, they forget it, they lose their medication, so they ask for a re-prescription. Mostly they come late to the interview, and of course treatment non-compliance is mostly encountered. One of the reasons is that after the diagnosis is made, medications are expected to create a miracle in 1 month, because they think that their memory will be fully open and they will concentrate 100%. And mostly we want the therapy to be continued for at least 2-3 months without any interruption, so that the efficacy of the medications start to be revealed. And misuse of stimulants, substance usage is also a problem, because we keep away from stimulants. They could have different adverse effects, because this is a situation which has to be evaluated well. And if there are comorbid situations, and dopamine enhancer antidepressants can be preferred. Maybe you've heard it, which this has been revealed in the research and clinical practice as well, the misuse of stimulants. Well, especially during the examination period, there are people who find psychostimulants from their friends, or else they use their acquaintances' medications, so we have to be really cautious when prescribing these medications. With non-pharmacological treatment, first of all, psychoeducation is important. So we should be explaining about ADHD and the challenges to be expected, the adverse effects and impact of medication is what we explain in the physical education, psychoeducation. And medication treatment is the most effective, but there are some residual symptoms that remain after the medication, even using the medication. So CBTs, cognitive behavior therapy, is a resort to be applied actually. And a CBT-oriented coaching actually more concentrates on practical problems. Again, it takes into account ADHD. It is more concentrating on targets and behaviors. Social skill training and adaptive dialectic behavior therapies are also recommended. And while implementing non-pharmacological treatment, comorbidity, anxiety and depression should be taken into account. We know that, what do we know in therapy? Medication for ADHD has higher treatment discontinuation than placebo, particularly when no concomitant psychotherapy is administered. A non-stimulant or long-acting stimulant is a better option for students with past substance use. These are factors to be taken into account. And also previously, with ADHD diagnosed students, it was foreseen, it was said that actually they couldn't enter university and study at a university, but now ADHD awareness has increased and these students can also study at universities, and they do so actually, and they need social support, therapy support, these kind of students, and they seek all sorts of support actually. When we look at the internet, for instance, survival guidelines, and even there are ADHD-friendly universities, or else vocational higher education schools, which help ADHD students. These students have got many challenges at the university. In our country, mostly at high school, especially in the United States, there are special accommodations in colleges, like extending time on tests and assignments, tests in a separate and quiet place, testing over several sessions, permission to record lectures, and also these are practices. So, finally, I would like to talk about the misusage of stimulants. Mostly the data is derived from the United States universities. Of course, stimulants are more prescribed. So this is not something which is not expected at all. Especially from Ireland and Israel, we also have data publications that refer to the misusage of stimulants. For instance, this was a study carried out in Iceland. Methamphetamine prescription is the highest. For this reason, they've checked university students, and 13% of the cases misuse it. And this is the medical faculty students of Israel. And according to this sample, this is a self-report data, by the way. It is not based on a comprehensive clinical evaluation. ADHD students misuse the stimulants. Non-indication stimulant usage is a fact, according to the study. As a result, diagnosis of ADHD in college students is based on a comprehensive clinical assessment. We don't have a single test, we need many measurements, and we don't have many evidences when it comes to treatment. When it comes to prescription stimulants, we know that they are being misused, especially how ADHD is best managed across the lifespan and across key transition periods such as in colleges needs more investigation. For young psychiatrists who evaluate ADHD students, I would like to make a call for you. This is a young psychiatrist network, and they're going to be holding their 6th meeting in Prague, Czech Republic in September. So I recommend you to follow these events, and if you're interested, you can also participate. Thank you very much for listening to me.